On-the-scene coverage of AHA 13 is supported by Janssen Pharmaceuticals Incorporated.
The findings of the CORAL study actually should have important implications for the use of renal artery stenting in the community. As we have an increasing push towards appropriateness in the way that we use these invasive procedures, appropriateness is going to be guided by the evidence that we have. And I think we've seen nice data here presented by the CORAL investigators suggesting that where you take individuals with a clearly prescribed clinical indication for renal artery stenting and they can't show an incremental benefit above and beyond medical therapy there, the question's got to be asked, what about the patients who are undergoing these procedures where the clinical indication is far more confusing and there's no data. So as there will be more and more of a push towards appropriateness of what we do in clinical practice, surely results like this will ultimately result in driving the rates of renal artery stenting down. So the question then becomes, is there a role for renal artery stenting at all? In the wake of these kind of findings, and the reality is it probably is. There's refractory hypertensive individuals who we can't control on 4 or 5 medications. Now we've seen a proliferation in renal denervation as a therapy, and whether that will have some impact on that remains to be seen. An example that was described here at the AHA of the patient who's anuric but still has viable kidney tissue on the side of the stenosis is probably a patient who actually does benefit from a perspective of saving the kidney. Again, these were not patients that were enrolled in the study, so we have to test those hypotheses by ultimately doing those studies. But it really does tell us that there will still be patients out there who I think will ultimately still have a reasonable indication to have renal artery stenting, but the indication should be ultimately far less than what we're seeing in terms of clinical practice.